Hello and welcome to Yoga Therapy for low back, sacrum, and hips. I'm Gary Krafso, founder of the American Yoga Institute. For the past 3 decades, I've spent countless hours working one-on-one in patient care and trained literally hundreds of yoga teachers, therapists, and health practitioners in the principles of yoga therapy to treat illness and promote health. This DVD features educational content and therapeutic practices for the low back, sacrum, and hips. These practices are based on the same method we used in designing the protocol for a National Institute of Health study that successfully demonstrated the effectiveness of yoga therapy for back pain relief. Whether you're suffering from occasional or chronic back pain, whether that pain is mild or even intense, or whether you just want to strengthen your low back, sacrum, and hips to avoid future problems, I hope you find these practices beneficial. Hello, thank you for being here today. I'm Gary Krafso, and today we're going to talk about the issue of low back pain and how yoga and yoga therapy can help to remedy low back pain. So we'll begin by looking at the scope of the problem of low back pain. Today, they say statistically that 8 to 10 people will experience low back pain sometime in their lives, and that it is actually the most common cause of job-related disability. And it is the second most frequent reason that patients seek primary health care. And finally, in the United States, we are spending alone, the United States alone, we're spending over $100 billion a year annually on trying to solve back pain problems for people. Now, the most common way that people deal with these problems include exercise, physical therapy, medications, and surgeries. And in addition, there are alternative healthcare practices such as acupuncture that have been very helpful. Now, despite the literally billions of dollars spent annually on these problems, they persist. But fortunately, Western medicine is beginning to appreciate the ancient yoga system. The National Institute of Health sponsored a low back pain study, which I designed the protocol for a few years ago. And in December of 2005, the results were printed in the Annals of Internal Medicine, which is a prestigious peer-reviewed medical journal. That study showed that Yoga is a safe and effective treatment for chronic back pain, that yoga itself is beneficial because it involves physical movement, but also because of its emphasis on mental focus, and finally, that yoga is going to be more effective than exercise classes in resolving these back pain issues. So what is this thing that we call yoga? You know, yoga is an ancient word, and it has many meanings used in many different contexts. So for the sake of the material that we're going to cover in this DVD, let's think of yoga as a process of self-understanding and self-development that's oriented towards reducing the symptoms and causes of suffering at any level that it may appear in your system, whether it's structural pain or the suffering from chronic illness or even emotional disturbances, and oriented towards developing positive qualities in oneself and increasing one's health and happiness, increasing one's self-confidence and state of well-being. Now, the process of yoga begins with awareness and self-awareness. And for the exercises that we use in this DVD, the next step is linking that awareness to the flow of the breath and the ability to deepen the inhale and lengthen the exhale. The next point is to link the flow of the breath to an awareness and to the mobilization of the spine. The breath helps us to become more aware of the spine and helps us to mobilize the spine. And as the spine moves, we then move the other limbs of the body, extending out from the movement of the spine. What is yoga therapy? The yoga therapy process uses yoga techniques for the treatment of specific ailments. This can be applied to structural problems or working to manage symptoms of chronic disease or working to help someone who's suffering from emotional disturbances. So the general structural goals of yoga therapy that we're going to be using in the practices in this DVD include, first of all, the reduction of pain and also inflammation. Then the increase of circulation. Increasing circulation, it's through the circulation that the tissue that's been damaged will heal. Also, improved function. And finally, an increased sense of self-confidence and well-being. So to put it very simply, there are two main goals in yoga therapy: reducing the negative, which in this case can mean pain and inflammation, and increasing the positive, which in this case means improved function, greater self-confidence, greater sense of well-being. Now, specific to the work in this DVD is the Viniyoga methodology, which uniquely emphasizes these 3 points. The first is differentiation. By differentiation, what I mean is the ability of the therapist or the practitioner to identify the unique individual nature of the condition that is being worked on, then the adaptation of the tools of yoga that can be used to help remedy the problem, and then the appropriate application of those tools to match that individual condition that's being differentiated. These principles of Viniyoga are ancient and have been passed from teacher to student for thousands of years. I personally have been working with this methodology for over 30 years and have done thousands of hours of one-on-one patient care quite successfully for these kinds of conditions. I'd like to talk with you about the kinds of pain or types of pain that you may be experiencing. The first kind of pain is chronic pain. Chronic pain can be constant or intermittent, but it's measured by duration. It goes for days, weeks, months, sometimes even years. The next type of pain is what is called acute pain. Acute pain is measured by a degree of intensity. Now, both chronic and acute pain have sensations that range from dull to sharp, even electric, and even incapacitating. These kinds of pain will limit the range of motion and cause loss of function. Other symptoms of pain include numbness, tingling sensations, weakness in the limbs, or shooting pain down the leg and into the foot. If these kinds of problems are present, please consult a primary care provider before you continue with the practices in this DVD. Now I'd like to talk with you about the causes of low back, sacrum, and hip pain. You can think about the spine as a weight support mechanism within the gravitational field, carrying the fundamental loads, the head, the shoulders, the thorax, the pelvis. All of these weights have to be transferred to the earth. The low back, sacrum, and hips bear the majority of that weight and therefore the majority of the stress in the body. Most causes of low back pain are non-specific and relate to muscle sprains or ligamentous strains that are the result themselves of poor posture, improper lifting, poor body mechanics, overuse, what we call repetitive stress injury. Also, accidents can be sources of low back pain and diseases. There's so many causes of low back pain that we're going to organize them into the 3 following categories. Diseases. Diseases are the causal factors of some of the most serious conditions of back pain. There are many diseases. Here I'm listing the most common that some of you may have been diagnosed with. The first is spinal stenosis, which simply put is a narrowing of the spinal canal that puts impingement on a nerve that causes pain. The next, spondylosis, is inflammation and degeneration of the spine itself. Spondylolisthesis is a joint instability condition where one vertebra slips in front of the other, causing nerve pain and thus back pain. Cancers and tumors represent major causes of back pain, as well as infections such as spondylitis, osteomyelitis, and sacroiliitis, which represent infections of the joints and bones and ligaments of the spine. In addition, there's age-related and non-age-related degenerative disc disease and osteoporosis, a metabolic disorder resulting in loss of bone density, and in addition, osteo and rheumatoid arthritis. Osteoarthritis leads to the wear and tear of the joint cartilage, and rheumatoid arthritis is an inflammatory condition that's related to an immune disorder. The second major category that's causally related to back pain are the injuries that happen through life. The most common is repetitive stress injury, which is simply what it says, that we create repetitive stress by movement patterns and daily activities. The next, of course, is the unfortunate accidents that occur. And these stress and accidents can lead to bulging and even herniated intervertebral discs, general muscle sprain and spasm, or ligamentous or tendon strain, or a condition called tendinitis. The third category of back pain are mechanical issues, the first being skeletal misalignment. Skeletal misalignment can be congenital or it can be developmental as we grow. The next is muscular asymmetry, also something that can be related to congenital skeletal misalignment or developmental because of skeletal misalignment or because of imbalanced daily activities. After that, we have the condition of hypertonic or hypotonic muscles. Hypertonic are muscles that are in a chronic state of contraction. Hypotonic are muscles that are weak and don't have contractural strength. Then one of the most sort of insidious causes of back pain are dysfunctional neuromuscular movement patterns that we've acquired since childhood that create repetitive stress injury that lead to back pain. And finally, a very common mechanical issue is nerve impingement. For example, sciatica, which is the pressure on this large sciatic nerve that exits the pelvis and runs down the leg. Sciatica itself is usually symptomatic of other conditions such as bulging and herniated discs. Now, if you remember, I said that yoga is fundamentally a process of self-understanding and self-development that leads to self-transformation. So in using yoga and yoga therapy, and in particular Vinyasa therapy, to work with back, sacrum, hip problems, the starting point is coming to a deeper understanding of the biomechanics of these regions of your body. What we see here is a posterior view of the skeleton in what is called the axis of the spine, or the axial skeleton. There are three main segments plus the sacrum. The first is the cervical spine, then the thoracic spine, and then the lumbar spine, and finally the sacrum. These four regions of the spine represent together what's called the axial skeleton. Next, we have the appendicular skeleton, which includes the shoulder girdle attached arms and pelvic girdle and attached legs. As you'll see later, understanding the unique axial appendicular relationship in your own body is fundamental to reducing the symptoms of back pain. Now we're going to take a closer look at the axis of the spine from a profile perspective, looking at the spinal curves and their functional relationship to each other. This green line represents healthy spinal curvature. The thoracic curve is known as the thoracic kyphosis, and this orange line represents excessive thoracic kyphosis. We could have also included another line showing flattened thoracic spine, both increased or loss of thoracic curvature. The yellow line now represents excessive lumbar lordosis. The curve of the lumbar spine is called the lumbar lordosis. This yellow line represents excessive lumbar lordosis. We could have also represented a line showing the loss of the lumbar curvature. So these lines represent the curvature of the spine, and a lot of the condition of low back pain relates to a poor relationship between the spinal curves. Next, let's look at the axis of the spine from a posterior perspective. This green line represents vertically aligned spine, an ideal condition for the spine. And this yellow line represents the lateral displacement of the spine known as scoliosis, which most of us have to some degree, but is also a factor in low back pain. Now we're going to look at the relationship between the pelvis and particularly the lumbar spine and the conditions of spinal compression that we have due to the imbalanced relationship between the pelvis and the lumbar spine. Here you see a balanced relationship, healthy pelvic tilt with no spinal compression particularly. Now we have forward rotation of the pelvis, forward pelvic tilt, which can create posterior compression in the back. And here we have the backward tilt of the pelvis, which can create anterior compression. So the relationship between the pelvis and the lumbar spine is very important in back health, and becoming critically self-conscious of the relationship of your pelvis to your low back is important in the yoga process. Now, still in this relationship between the pelvis and the spine, from a posterior perspective, we're looking at the alignment of the pelvis and the vertical axis of your spine. This green line shows the idea of a balanced relationship between the pelvic girdle and the lumbar spine. Here we see hip elevation. It's very common that one hip is higher than the other. When that hip is higher, it will create some lateral compression in the intervertebral discs. And the other is the forward or backward rotation of the pelvis. Pelvic rotation and hip elevation are both significant factors in common low back pain. Now we're going to look more in depth at the pelvis, and in particularly the ligaments of the pelvis that bind the leg to the pelvic girdle. It's very important to understand your own ligamentous condition. Some of us are born with congenitally shortened ligaments, which restrict range of motion, and some of us are born with congenitally longer ligaments, which create great range of motion and potentially joint instability that results in back pain. The first three ligaments we'll look at are those ligaments that bind the femur, the top of the leg, to the pelvis at the hip itself. They are the ischiofemoral ligament, the iliofemoral ligament, and then the pubofemoral ligament. Understanding these ligaments and being able to stabilize this joint is an important task in the yoga therapeutic process. Now we'll look at the ligaments of the sacrum, the sacroiliac ligaments that bind the sacrum, the bottom part of your spine, to your pelvis. Again, it's very common that there's sacrum pain due to strain and stress in the sacroiliac ligament. So now, reviewing where we've been, it's important for you as individuals to understand the condition of your spinal curves and their functional relationship to each other, and the relationship between the appendicular skeleton, which means your pelvic girdle, and later you'll see your shoulder girdle, and the vertical axis of the spine, and the condition of your ligaments, particularly the hip ligaments, whether they're long, which creates hypermobility, or short, which limits range of motion, and most importantly, the condition of your sacroiliac ligament, which, if it is strained, will cause deep pain in the low back. Understanding the bones and the ligaments, we now turn our attention to the muscles. There are many, many muscles in the body. This will be a short presentation of some of the important muscles fundamental to health of the low back, sacrum, and hips. First is the erector spina that runs up the back, and then we have the iliopsoas group that bind the leg through the pelvis to the spine. These are two of the fundamental muscles that are important to work with in rehabilitating conditions that lead to back pain. In addition, we have the quadratus lumborum, a deep lateral flexing muscle of the body. Next, we have the rectus abdominis that, among other things, control the pelvic lumbar relationship and enable you to influence that tilt that we talked about earlier. And then there's the external obliques, which are among the muscles, along with internal obliques, that create rotation of the torso. And then the gluteus maximus, one of the many muscles that are hip extensors. These muscles are fundamental to the stability of the torso. But when we talk about low back, sacrum, and hip pain, we also want to look at the muscles of the legs. and the upper legs in particular. So here we have again the iliopsoas, very important muscle that binds the femur through the pelvis to the spine. Also important are the hip flexors that are responsible for flexing the leg, and the hip extensors that are in the back responsible for lifting the leg behind. In addition, we have the hip abductors on the outsides of the thighs that take the legs away from the midline, and the hip adductors on the insides of the thighs that take the leg across the midline. These fundamental muscles we'll be working with in the exercises that follow in the direction of rehabilitating hip, sacrum, and low back problems. Now, all of these muscles that we've named, both of the torso and of the legs, are paired. That means you, for example, have right adductor and left adductor, right iliopsoas and left iliopsoas. One of the things that's important to understand is the asymmetric development of these paired muscles in your own body, because we'll use the yoga process to help restore symmetry. And furthermore, another important thing to understand about the muscles is their hypotonic condition. Remember that a hypertonic muscle is chronically contracted. A hypotonic lacks contractile strength. So in addition to the symmetric development of these muscles, you want to understand which of these muscles are in a state of chronic contraction, which of these muscles are weak, and use the yoga process to strengthen what's weak, to release chronic contraction where it's there. So let me review all of this by listing for you specific goals of yoga therapy related to low back, sacrum, and hip pain. First thing to think of is postural alignment, and use the postures to improve the alignment of your bones. The next thing to consider is increasing structural stability. This is a ligamentous phenomenon. If you have hypermobility in your joints, we'll want to strengthen these core muscles to increase stability. After that, it's important to increase range of motion. This would often be a ligamentous phenomenon if your ligaments are shortened. Also, it can be when you have hypertonic muscles that block movement. Another important goal is to strengthen the weak muscles so that we restore balance and strength to the body, and releasing chronic contraction, which we've spoken about already. Next, as I said earlier, it's important to balance muscular asymmetry, and finally to develop healthy movement patterns. Movement patterns are a neuromuscular phenomenon. We're conditioned to move in certain ways. One of the problems with neuromuscular patterns is repetitive stress injury that's created from unhealthy movement patterns. One of the gifts of yoga process and yoga therapy, in particular Vinyasa approach, through repetition of movements, is to develop new and healthy, more functional movement patterns. So I'd like to define for you all 4 fundamental principles that are important to understand in applying these practices for the Vinyasa approach to yoga therapy. The first principle is the relationship between breath and movement. In yoga, if you remember earlier in the DVD, I mentioned that the fundamental principles of the yoga process include awareness, breath, and movement. So the gift of the breath is that it enables us to feel more intimately the movement of the spine. And also the breath will activate the movement of the spine. It's not the breath itself, of course, it's the fundamental muscles of respiration, particularly the diaphragm, the intercostals, and adjunct muscles for the inhalation would be the erector spina. And on the exhalation, we're intentionally engaging the abdominal rectus muscles. So for the sake of the practices in this DVD, this is not a global statement about breathing in yoga, but particular to the structural therapeutic orientation of this DVD, I'd like you to think about inhalation and primarily the expansion, horizontal expansion of the thoracic cavity and the vertical extension of the spine. The idea will be to focus the inhale in expanding the chest and feeling the ribs lifting vertically away from the pelvis. I'll give you a frontal demonstration of this kind of inhalation that I'm talking about. So if you noticed, as I began to inhale, my chest expanded. I was lifting my sternum vertically up and away from my navel. So there's a slight stretching in the front of the body. If I give you a profile view, and I'll exaggerate a little bit so that you can see that action. What you can notice is that in quick time, I lifted my sternum away from my navel, and the effect was that my upper back flattened and my ribs lifted vertically away from my pelvis. So this kind of inhalation promotes the natural axial extension of the spine. That's the gift of inhalation. So for the exhalation, I want to give a demonstration from a frontal view, but I'll use my hand to support what's happening so you can see what's happening. Consider that my pinky represents the insertion of my abdominal rectus muscles into my pubic bone. And then as you move up my hand, the fingers, the thumb is the origin of the abdominal rectus here up at the sternum. And as I exhale, I'll contract the fingers in an upward flowing way so you can see what I'm doing with the muscles of the abdomen. So at the end of the exhale, I'm still holding my belly from my pubic bone to my sternum firm. When I inhale, I expand my chest. And then begin to relax the abdomen from the sternum down to the navel. I'll show you a view of this exhalation and inhalation from a profile. I won't use my hand. I'll exaggerate the action that exhalation creates in the pelvic-lumbar relationship, which is important in the practices that we're using for the therapy, especially for the low back. So as I exhale, you'll see, and I'll show with my hand, the action of my pelvis. My belly comes in, my pubic bones lifted slightly, my hip bones drop down, and my erector spina are stretched. So if I combine inhale and exhale and exaggerate, this is an exaggeration, the action in the spinal curves, I'll increase my lumbar lordosis and increase my thoracic kyphosis. Inhalation. And exhalation. Inhalation and exhalation. The idea then is to use the inhalation and exhalation to integrate the spinal curves. Inhale again, primarily expansion of the chest, flattening of the thoracic kyphosis, axial extension of the spine. Exhalation, primarily stabilizing the pelvic-lumbar relationship, also stretching the low back. Now, I had talked about awareness, breath, and movement. So the next point is how to actually do an individual posture. The starting point is to have a clear intention for each posture. For example, the practices in this DVD, you can see the intention in the workshop section of the DVD of every posture. When you have a clear idea of the intention, you direct your awareness through attention to the breath. Then through the breath you mobilize the spine. As the spine begins to move, the limbs of the body move in relationship to the movement of the spine. So it's awareness, breath, movement of the spine, movement of the limbs. This is the focus during an individual asana. Now, when we're doing individual asanas, in particular in this DVD where the orientation is specifically structural benefit, we're using a lot of repetition. That is, each posture begins in a neutral starting position, then the posture begins by the movement of the spine and the limbs to the main posture or to the form of the posture, and then you return to the neutral starting position. Many people think of yoga as just static postures, but the teaching of this tradition, the Vinaya Yoga teachings, and as well the insight of modern Western exercise physiology, is that to effect significant structural change, repetition is a powerful tool. For example, when I bend forward, the muscles of my back stretch. When I come up, those same muscles contract. In order to change the condition of the muscles, it's not simply a matter of stretching them, but it's alternating stretching and contracting. This creates what we call in Western physiology proprioceptive neuromuscular facilitation, abbreviated as PNF. That means more circulation, the muscles get more relaxed and yet stronger. The yogis recognized this. The ancients knew that in order to effect change in the body, repetition was the most effective means. The static postures have very deep, even physiological effects, and we use them especially when we're doing yoga therapy for chronic disease and psycho-emotional well-being. But for structure, repetition is very important. Still in the discussion of how to do an individual posture, the third thing that I find very important to mention here is the topic that I call the adaptation of the forms of the postures. In the yoga world, for example, many people have the notion that each posture has a correct form, and the way to practice the posture is to master the form of the posture. In Vinaya Yoga, we talk about the functional effects of postures, and we adapt the form of the posture to serve the particular function we're trying to achieve. For example, if you look at the practices in this DVD, you'll see in each sequence certain postures that are repeated throughout. However, if you practice them, you'll feel in your own bodies that the postures are done in different ways. The adaptation of the forms of the postures in each DVD is related to the specific intentions of the practice. So in one posture, you're doing it to stretch the back. In another DVD, that same posture, you're doing it to activate the muscles of the shoulder girdle or to stretch the neck and shoulders. So this idea of liberating you from what I sometimes jokingly call the tyranny of the form of the posture, and be able to have the freedom to adapt the form of the posture to produce particular and different effects in your body, it's important to understand when you begin these practices. Finally, the last point I'd like to discuss with you is that there's an art and science of sequencing, also known as vinyasa krama, used in this methodology of practice. The principle is very important that each individual posture by itself may have a theoretical effect, but the way in which you combine the postures changes the effects of the same postures. So there's a science behind the sequences that are in these DVDs. All the different practices are intentionally placed in specific orders, and the effect of the same postures would be very different if they were placed in different order. Much like vocabulary in sentence structure. You change the order of the words, you change the meaning. So different sequence combinations produce different effects. So I'd like to just review these 4 points for you that are so important in this methodology of practice and in yoga therapy in general. One is the primacy of the breath and the fundamental focus of the relationship between the flow of the breath and the movement of the spine as you do each posture. 2, become clearly aware of the intention of each posture, then link your awareness through attention to the breath, and link the flow of breath to the movement of the spine, and from the movement of the spine, the movement of the limbs. The next point is that in these practices, we're not just staying in postures, but we're moving into and out of in a very particular way, with a very particular intention in relation to the muscles that we're working in the practice. 3, don't be surprised by the same posture done in different ways. There's not one correct way to do a posture. The correct way to do a posture is the way that maximizes its functional benefit for your bodies. And the last point, again, is just please, when you practice these sequences, follow the order. It's a very carefully thought out sequence. There's nothing arbitrary or random about it. There are 3 practices in this DVD on low back, sacrum, and hip. Of course, you can practice any of them, but if you would like my suggestion, I would recommend beginning with the low back sacrum practice. This is the simplest practice. There's no standing or seated postures in this practice, and it's designed fundamentally to improve the pelvic lumbar rhythm and to strengthen the muscles of the low back, hips, and sacrum in a very effective and safe way. So this one is called low back and sacrum. The second practice is called hip. This practice on the hip is also a simpler practice. It emphasizes the hip from four perspectives: the front of the hip, the iliopsoas muscles, the inside, the hip adductors, the outside, the hip abductors, and the back, the gluteus and piriformis muscles, and of course the muscles of the low back, the erector spina. This hip practice is also a very effective practice. However, there's movements in the hip practice that might be mildly irritating if you have a bad sacroiliac ligament. And so if you do have that sacrum pain, please begin with the first practice, the low back and sacrum. The third practice is a longer practice which synthesizes those first two practices and then adds some more postures. This would be a kind of a preventative practice when you're starting to feel better with low back, sacrum, or hip pain. You're starting to feel stronger, but you want to avoid recurring incidences of these problems. So this practice is a little stronger, but it will help you develop strength and maintain that strength and avoid recurrence of future problems. I want to caution you, however, that none of you who have disc herniation or symptomatic stenosis, spondylosis, or spondylolisthesis, or any other acute symptoms that may be the result of diseases or injury, none of you should practice this without the guidance of an experienced therapist. With proper guidance, you may find these practices helpful, even from the most serious back pain. But please see somebody personally who can help guide you in these practices before you begin them on your own. Now, for those of you who are going to begin these practices, I'd like to first of all tell you that these practices have a cumulative effect. So when you do it the first time, you'll feel nice in your rest, nicely relaxed, and some circulation in your body, some energy. And there's also a time release effect. When you get up over the next hour or two after practice, you should feel the effects of the practice. But the cumulative effect is best felt when done over several weeks and even several months. These practices can be done again and again and again for weeks and months and even years. They're very simple. They're like brushing your teeth. Every day you brush your teeth. If you do some of these simple practices, like the low back sacrum practice or the hip practice, regularly, they will serve your body and be as fundamental to your spine and the biomechanics of your spine as brushing teeth and using dental floss. So be consistent with your practice. Maintain the practice over time, just like brushing your teeth and using dental floss, and enjoy.